A group of health experts is urging the government to take a more proactive stance on public health. Launched in Cape Town this week, the Health Tax Alliance is calling on government to increase taxes to regulate the consumption of tobacco, alcohol and sugar products. Let's bring in one of the organizations involved. We're joined now by Director of the Rural Health Advocacy Project, Mr. Russell Rensburg. Russell, good morning to you. Thank you so much for getting up this early for us. We really, really appreciate it. Such an important discussion, and we've already been talking about some of the bad habits that we see in our community and what are some of the options that we have really to deal with them. But I want to start with the who, right? So the Health Tax Alliance, who's involved and how did this formation come about?
Yeah, obviously, as you know, healthcare costs are rising all the time. And as those costs rise, it has a massive impact on our ability to deliver services as a country, because we're quite lucky to have a fully publicly funded system. So we all came together. Well, this includes the Rural Health Advocacy Project, Tobacco-Free Kids, the National Council Against Smoking. We had some academics from REAP, which is at UCT. We had some people from Priceless who looked at the sugar tax. And then just and the Public Health Association of South Africa, the Treatment Action Campaign, the SANAC Civil Society Forum, and a number of other partners, just to sort of have a discussion and think, how can we use this effective policy tool we have in health taxes to better mitigate the impact on the health system, on the consumption of products like tobacco, alcohol, and sugar?
Yeah.
Yeah.
So this is where it gets quite interesting for me, because then there's the proposal that the organizations that are the Health Tax Alliance put forward, and I think these are going to make a few people jump back, particularly if you are a user of some of the goods that you've talked about. You talk about how the World Health Organization has recommended excise tax increases of up to 70%, again, 70% for tobacco, alcohol, and sugar-sweetened beverages. And you're aligning with that recommendation?
Yes, we are. And everything is obviously progressive. And South Africa already does a significant amount of taxing on some of these products. But we feel that the pace of those increases have actually slowed down in recent years, where we've only really increased by inflation and sometimes less than inflation. And by doing that, we're really minimizing the impact of those taxes. Because South Africa has been obviously a leader in things like tobacco control for a long time. But, with a number of missteps, the taxes no longer align with the impact that tobacco has in our health system, or tobacco use has in our health system, with up to 48 billion rand in health costs annually, which far exceeds the amount of money that we raise from the taxes at the moment, or even tobacco revenue in general. Similarly with alcohol, one of the most startling statistics in our health statistics at the moment is that the leading cause of death of men between 20 and 25 is interpersonal violence, often related to alcohol. And then similarly, with sugar, we haven't really increased the health promotion levy since 2018. And diabetes, as we remember from COVID, was one of the leading causes of death. And at the moment is probably the fastest growing cause of death in South Africa. So these health taxes really present an opportunity for us to change the shape of how we consume some of these products. And they really but on their own, they obviously won't address the bigger challenges that we face. But we want them to be a little bit more commensurate with the public health impact that they have. And increasing health taxes is an easy way to do that.
Yeah. So, but you're agreeing with the World Health Organization on 70%, because I'm doing some of the mathematics here, and if you, for instance, are buying a pack of cigarettes for 50 Rand with a 70% tax, increase, you're looking at what, 85 Rand for a pack?
Yeah, but that is, at the moment, we already tax about 50% of a pack of cigarettes, right? But the chain, but it's based on a total selling price, and there's a broad range of it. So we align with that, but we're asking for probably another 15% increase on tobacco tax. In addition to what we have now, to bring us in line with that. But when you think about it, when you travel overseas, you're probably going to pay 15 pounds for a packet of cigarettes, which translates to at least like 500-600 Rand a packet of cigarettes. And it's the same cigarettes. So I think there's a fair amount of room to use this tax policy. And what was worry us is that incidence of tobacco smoking is increasing, whereas in the world it's decreasing. So currently around 24% of South Africans of adult age are smoking, compared to 18% a couple of years back. And that is really, really problematic. And we need to start cutting off those tabs. And there are multiple ways that we can do that. And I think the tax is probably one of the first steps that we can take.
Yeah.
And there are other things that we need to do around regulating the illicit sales of tobacco as well.
Yeah, you know, when you talk about illicit sales, it brings me back to the issues that we saw perhaps during the COVID-19 pandemic, right? You'd remember that there was a point where the sale of tobacco was banned in the country, completely banned. And then the illicit market just, I mean, it was out of control. I don't think anyone can argue with that. And people in South Africa were telling you how they were buying alcohol for exorbitant amounts of money. They were buying tobacco for exorbitant amounts of money. The reason why I bring that up is I'm trying to, I suppose, find the link between paying more, whether or not that actually impacts and influences behavior. So during a period like COVID-19, do you have data on whether or not people's behavior changed as a result of, you know, the pressure that they were on financially, if they were going to the illicit market, and if they weren't, the non-availability, if it impacted on their behavior?
Look, I think there's probably a core group of smokers that don't give up, right? So they're insensitive to pricing, but they substitute it, right? So I think that's part of the challenge at the moment, because when we banned tobacco sales, you know, tobacco is nicotine is an addictive substance, probably more addictive than heroin, but it's an acceptable addiction. And it's not very easy to get off. So what happened was that people substituted for cheaper brands. And the problem is that because of that extended period, they haven't switched back.
Oh.
And in some ways, it's led to a growth in the illicit sales. But we feel that these are two separate problems. So on the one side, we want to stop new smoking. And to stop new incidents of smoking, I think the tax is very effective. But then there are other measures that we can look at to mitigate the impact of illicit sales. And a big part of that is compliance, really just investigating all of these shops, conducting regular raids on small retail outlets where a lot of these cigarettes are sold. And as we confiscate more and more of them, I think the tendency to want to keep them available will become less and less.
Yeah.
But there are multiple different ways of doing that. But what we basically arguing is that there's two separate arguments. On the tax side is to really reduce the incidence of smoking. So we don't want more people to start, because it's easy to start, but not easy to quit. And on the other side, we're calling for increased compliance, you know, just of regular bylaws and the like, and the regular inspections to curb the sale of illicit tobacco, which is to that group of consumers who are very hard or very ingrained in their smoking, and it's not that easy to quit.
Yeah.
So it's like two different things that we're wanting to address.
So we've touched on the issue of whether or not, if you hit the pocket of the consumer, that you're able to influence their behavior. But I'm keen to hear as well what, when we look at the bottom line for the nation, right, what tobacco, sugar and alcohol are costing the South African health system, for instance, or even the economy. What does that data look like when you perhaps start to attribute, you know, diabetes in South Africa?
There are 5 million plus people living with diabetes at the moment, based on estimates developed by the National Department of Health and other researchers. And of that, only 1 million are currently receiving care. So we have a massive problem there. And diabetes is the leading cause of deaths after infectious diseases like tuberculosis. But tobacco also makes tuberculosis treatment worse. It also makes HIV treatment worse. It also makes hypertension interest worse. So tobacco use is a key contributor to poor health outcomes. In terms of sugar, you know, sugar is incredibly dangerous insofar as it contributes to diabetes, contributes to hypertension, obesity, which is growing in South Africa, also contributes to a host of other different health ailments. So the cost of the economy, we estimated to be around 600 billion rand a year, whereas that's broader costs in productivity, costs in healthcare, costs in the disease-adjusted life years and so on.
Yeah.
Right? But it's significant. But it's not easy to counter these things, and we don't want to be a nanny state either.
Yeah,
All we're
sorry.
asking is that we use our tools better.
Okay,
Right?
I need to squeeze one last one in here, Russell. What happens now? You've made the recommendations. I know that the alliance was formed actually with, I believe, the DDG, was it? Yeah, the DDG from the National Department of Health. So what happens to these recommendations now?
Look, I think in the recommend, we're obviously going to use all the policy processes that there are.
Yep.
You know, first of those is the budget. So in the tax proposals, we will be making calls to increase these taxes. And as a public participation process, the point then is to start building support for the increase of tobacco by at least 15%, increasing the HPL to at least 20%, and then looking at the way that we currently tax alcohol. Because I think one thing that we learned over time is that because it seems that taxation on alcohol is more on alcohol content, and there's very little consideration of the public health impact of excessive alcohol taxation. So I think at the moment we need to probably do a little more work, but at the bottom line, it's really about dialogue. It's about making proposals. It's about discussion. And it's really about disease prevention in the long run.
Okay.
So it's not really out there to hammer people, but it's just asking to use the tools that we have more effectively to control and protect the population against the ills of tobacco, alcohol, and sugary sweetened beverages.
Okay, great. Keep us updated on the progress that you make, please. We really appreciate the chat, Russell. Thank you so much for waking up so early to have this chat with us. Russell Rensburg, they're Director of the Rural Health Advocacy Project, and they, of course, are part of the Health Tax Alliance, speaking to us. We take a short